Hello. Today we will see the case of a 25 years old female patient who suffers from breast cancer. Next, please.
We present a rare case of breast cancer in a 25 years old woman with no family history, a 1 year delay in diagnostic, and at advanced stage T4N3M1. She underwent a modified radical mastectomy and received radiotherapy, chemotherapy, and hormone therapy. She remains asymptomatic after 2 years.
Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. I left unchecked, the tumors can spread throughout the body and become fatal. Breast cancer cells begin inside the milk ducts and or the milk producing lobules of the breast. The earliest form in situ is not life-threatening and can be detected in early stage. Cancer cells can spread into nervy breast tissue invasion. This creates tumors that cause lumps or thickening.
Another definition that we give to this is breast cancer is a type of cancer that forms in the cell of the breast. It can occur in both men and women, although it's far more common in women. This is often begins in the lobulus or the ducts and can spread to nerve lymph nodes or other parts of the body if not detected early. Next, please.
Case presentation. 25-year-old woman nulliparous with menarche at 14 years old of age and menstrual formula FM630, medical history scoliosis and pectum excavatum. She consulted on 25 for 2006 and as an emergency for hardening of the breast and telorrhea. She had noticed the nodule 1 year ago. No alterations were seen in the breast ultrasound at a time.
Symptom breast cancers, a lump in the breast or underarm, change in breast space, such as swelling or an air of skin retraction, nipple retraction and eczema, blood discharge from the nipple. If there is the breast spine, it is lacking a brain indication, but it may also indicate breast cancer. Changes in breast skin that resemble the texture of an orange peel.
It's important to note that early stage breast cancer generally does not cause symptoms, highlighting the importance of imaging studies and histopathology for diagnosis and detection. In this particular case, we already saw the bloody secretions and the palpable tumors. Next, please. On physical examination, I had a 150 nodule centimeters in diameter in the CSA of the MI and a periareolar induration area. A tumor was noted that occupied the entire breast and in the armpit palpable lymph nodes.
Diagnosis breast cancer in young women presents certain challenge due to greater density in the breast tissue, which makes detection through mammograms more difficult. However, a combination of self-exam, clinic exams, and imaging studies is essential. Mammography remains a standard tool, although ultrasound is preferred in women under 14 as it's more effective and distinguishing between cysts and solid masses. Diagnosis confirmation is achieved through a biopsy, which allows pathological analysis and determination of hormone receptors. Biopsies can be at different types, such as fine needle aspiration, core needle biopsy, or vacuum assisted biopsy, each with advantages depending on the size and location of the tumor.
Among other complementary tests to detect breast cancer, we have magnetic resonance imaging, useful assessing high-risk case such as patients with BRCA1 or BRCA2 mutations, or for determining the extent for cancer if women with advanced tumors or dense breast tissues. Another positron emission tomography, computed tomography. Although less common for initial detection, it is used in advanced breast cancer case to evaluate disease extent and detect metastases in other body parts, such as the lungs, liver, or bones. Uh, gene- Genetic testing. For patients with family history of breast cancer or in high risk case, testing for mutation in BRCA1 and other genes is recommended. Next, please.
Next,
Diagnosed with a tumor occupying approximately 17 of a mammary gland with palpable axillary lymphadenopathy.
The treatment modified radical mastectomy was performed. The circle the train is indicated in 70-18 of case as is the less aggressive and does not require the complete removal of the brain. Uh, Mastectomy in 20-30% of case, complete removal of the breast is necessary. Simple mastectomy or modified radical mastectomy. Received radiotherapy, chemotherapy, and posterity radio is essential as it reduces the risk of the call recurrent by a tear.
Well, there are different treatments, including local treatments and systemic treatments. The local treatments like surgery and radiation are local, meaning they treat the tumor without affecting the rest of the body. The system treatments and its example drugs using to treat breast cancer and considered systemic therapies because they can reach cancer cells at most anywhere in the body. Some can be given by mouth, injecting into a muscle or put directly into the bloodstream. Depending on the type of breast cancer, different types of drugs treatment might be used, including chemotherapy for breast cancer, hormone therapy, targeted drug therapy, and immunotherapy.
The immune system plays a crucial role in the development and control of tumors. Immunotherapy aims to simulate or repair the patient's immune system so that the body listen can fight against the tumor disease.
For this patient, egg or embryo cryopreservation is the most recommended method, as it offers high success rates of safe opportunity to conceive after treatment.
The patient in this case underwent preventive process and underwent tests for ovarian cancer, which as we know can be a complication of breast cancer. She underwent egg preservations and various complementary studies to verify that there were no complications. This is this case. Goodbye.